Hi, everyone. Thank you so much for joining me today. I have Denyse Whelan, who has kindly agreed to spend some of her time telling us her story. So, Denise and I actually met online because she is the ambassador for Head and Neck Cancer Australia. So, I thought that we'll get together and have a little bit of a chat. So, Denise, can you tell me a little bit about yourself and your journey?
Sure. Look, from education, I've been a K to 6 school principal, and I was retired and living what was supposed to be a relatively quiet life. But I did have some problems with my mouth, and that was in the gums, I thought. And I did have some dentists and so on look at it, but it worried me for a great deal. But before I get into that, I would have to say that I've always had some issues with my mouth, and I always thought way back it was always my fault. I now know it wasn't always my fault. So that's something good for all the people who are listening to this. But I've got to say, my mouth was a concern for me probably from 2016 onwards. So I can certainly tell more of that story as we go along, Amanda. And thank you for having me.
Oh, no, my pleasure. So, how did you get diagnosed? Was it difficult to be diagnosed? And tell
I
us
am nodding. I am
yes.
nodding. I think over time, and it was about a year from, say, mid 2016 into 2017, my mouth did present sort of in a sore state from time to time. But given I had a bridge of teeth covering where the area was, and any time I saw a dentist, they would say, "Oh, you're not cleaning it properly," or "You've got some candida there." Now, I understand that happens in our mouths and so on, but I was going through a rather stressful time anyway. And another dentist, the one who ended up becoming my regular dentist, said to me he wondered if my immune system was a bit down because I'd been particularly stressed over the previous 2 to 3 years with just life events and so on.
Mm.
However, he he and I sort of worked together over time when my mouth worsened. He did send me off to have the gums, the mouth cleaned, that sort of thing happen. And it always came back, no, you're just not cleaning well enough. You need to have the underneath there cleaned better, blah, blah, blah. So knowing who I was and how I was and being told to take candida, the fungalin and Nilstat and so on, they upset my gut anyway, and my gut was already upset. So I got a little bit frustrated and sad, I guess, because I just wasn't feeling well. Fortunately, I had a great relationship with this relatively young and wonderful man called my dentist, who's not my dentist now because I've moved back here. But he he and I had a yarn at the beginning of 2017 when I just couldn't work out what was going on. The gums were swollen, the gums were a bit overgrown, they were coming down over the teeth that I had there. And I said to him just one day out of the blue, I said, "Can you take this out?" And he said, "Oh, Denyse, we wouldn't want to do that. That's big deal. That was put there permanently and so on." And I just basically said, over time, I've got to know what's under there. I was just so stressed. And what was it? I don't
Mm.
think I ever really thought cancer, but I had to know. I had to know.
Yeah.
And that was when he agreed to cut the bridge out. And that was a very big deal for me because
Mm.
I've always had some sort of anxiety about going to the dentist, but to go to the
Mm.
dentist, even though he's lovely and even though I had all the tools to help me, it still was a stressful time. And that was in early April
Mm.
2017. And he did remove the bridge and he did remove the teeth that were attached to the bridge. He said he broke several diamond cutters. I don't even know what that means,
Mm.
but you know what I'm talking about.
Mm.
But I got through it, so to speak. I was pretty
Mm.
brave, and my husband was there to take me there and bring me home. But it was quite a brutal sort of thing that happened. It was very, they came out, that everything came out.
Mm.
And what I was left with was what I would call flappy gums, and he did too. But he didn't do anything about that then. He put a temporary denture in, and that hurt me a great deal because it was going on to sore skin anyway, but skin that had just had everything removed. But he said, "Let's wait time. Let's just see how you go." And then he went on holidays. How dare he go on holidays? Because my mouth got worse. So I couldn't see him for another 5 weeks. And I guess things were starting to bother me in the point that I probably needed to let the current GP know what I had there. So I went to her early May. So we're talking about a 4 to 5 week gap here, early May. And I said, I think I should show you what my mouth looks like. And when a GP does this, you go, oh, not a good look. So she said, Denyse, I had no idea. And basically, she didn't, because I hadn't sort of really shared it much with her. I had other things. And she sent me off. She said, you're going to the dentist tomorrow. That's good. Now I'm going to send you also for a CT scan and so on. He saw me the very next day and he said, let's get a biopsy done. And he called it urgent. And I thought that was just to put me out of my misery, but I think it was more than that now. So on that very, on the day of the Friday, I had, it was the 12th. I remember dates. So I had the biopsy in the morning, the CT scan that day, and waiting. And I was waiting around till after Mother's Day that year, the Wednesday on the 17th of May, she rang me. She said, Denyse, further biopsy results from pathology have shown SCC in the gums. It was good to have an answer.
It was. So all up between when you first started noticing symptoms and when you were diagnosed, that was over a year.
Close to a year, if not more, yes.
Is there anything you think that would have helped you have a diagnosis faster? Because obviously what we do with HANCA and you do as well is we try to raise awareness about it.
Yes, exactly.
Yeah. What sort of message would you like to give health professionals if you could?
Oh, look, my message is to please do mouth checks. I mean, I have only become aware that many dentists don't necessarily do that. They just go in, look at the teeth and so on. But please do a mouth check. Ask the patient to move the tongue left, right, underneath and so on. Hold open the cheeks. Have a really good look around. I don't think either that there is enough education going on for dentists and GPs for awareness. And that's why HANCA's got this terrific new 2-hour module for both. And I'll give a shout out for that here because why not know more?
Most of this would probably go towards health professionals.
Yes.
But if there are any patients that are watching this, do you have any tips on how to find, best find support?
I think I tend to recommend Head and Neck Cancer Australia. It used to be known as Beyond 5 when I first came on board as a patient and then became an ambassador. There's a multitude of files and other images and videos and all sorts of things to look at there. Head and neck cancer is so big and it's got various subsections and groups. And I know initially, Amanda, I have to say this, I was overwhelmed a little bit with the news. I didn't even know you could get SCC inside your mouth. I thought all SCCs were outside. So I had to learn a bit along the way. But I wasn't ready initially to do a lot of my own research because I did trust the care professionals and I trusted my body to do the right thing by me. And that's all worked out in its own way. But definitely Head and Neck Cancer Australia now has just got so many resources and so on. But if the patient, him or herself, doesn't feel up to it, a carer might, a family member might, and do that kind of helping out. Who would you go to? I could never say that. I just know that I turned out to be sent to the best person that could have helped me with mine. So I always feel grateful for that. Can I just say this too? Any patient and carer and or family member going to see a specialist and hearing all this news, it can be very overwhelming. I had almost a mini panic attack in the middle of my first consult. I got over it with a little walk up and down the corridor with my husband. But, it's confronting surgery that I had to have. I didn't have radiotherapy or any other thing. I just had 4 surgeries over time. But trusting your team is part of it. Often a head and neck cancer team will have a nurse that you can contact if you've got any questions and so on. In the bigger places, yes. People who live in regional and country areas sometimes are more challenged, but like we're talking now, there are avenues for connection and keeping in touch.